Yes, sir. Now it's time to introduce our speaker for the session on global and Indian scenario of stroke. I would like to welcome Dr. G Pradeep, sir, for the session. Dr. G Pradeep Kumar, Senior Consultant, Neurologist and Deputy Chief Stroke Program Medical Director, Baby Memorial Hospital, Kozhikode, Kerala. He has 2 decades of experience as a consultant in neurology and is the first president of the Indian Stroke Association. We are eagerly waiting to hear from you, sir. Please, sir.
Thank you very much, and thank you for this excellent conclave, which is timely. Because stroke is one of the most disabling disease of the world, and it is second most common cause of mortality after coronary artery disease. And the stroke there are 2 types of stroke. One is ischemic stroke. 85% of the stroke are due to ischemic stroke or thrombotic stroke, and 15% of stroke are hemorrhagic stroke. And I will be just mentioning about the overview or the global burden of stroke and what is the Indian scenario as far as the stroke is concerned, because it has got a lot of impact on the economy, not only in the individual level, family level, social level, and country at large. Every stroke is causing huge impact on the economy of a country. Stroke, the incidence of stroke and prevalence of stroke have already been studied, but in India, the studies are very few in number. Globally, it is about 12.2 million. 12.2 million people suffer from stroke, and 1 in every 3 seconds. Next slide, please. Can I have the next slide? So you can see in this, every 3 seconds, 1 person suffers from stroke, and this number is almost doubled over the last 3 decades. Previously, it was 1 in 6 and all. Now it is every 6 seconds. Now it's every 3 seconds, 1 person develops stroke. And the number of strokes, 85% of the global stroke and the disability combined residents in the low and middle income countries. That's also one of the important points, because the low and middle income countries are not well equipped to tackle the non-communicable disease like stroke. So 1 in 4 people will suffer from stroke during their lifetime. So that is another important landmark which is mentioned here. And up to 80% of stroke and heart attacks occur in the low and middle income countries. And in 2019, it was found that 63% of stroke happened in people who are younger than 70 years old. Previously, it was a disease of old age. Now it is coming down, and almost a tune of 20 to 22% of stroke occurs between the age of 30 to 45. So all these statistics says that stroke is one of the important health issues which is to be addressed, and it should be addressed in a systematic and proper way with a proper policy for management across the country. Next slide, please. Coming to the Indian scenario, stroke is the second leading cause of death in India as well. And approximately age-adjusted prevalent stroke in India is about 84 to 262 per 1 lakh population in rural areas, and 334 to 424 per 100,000 population in urban areas. So the recent data from the global burden of disease suggests that high burden of cardiovascular disease in India is due to a major epidemiological transition, leading to a surge in the non-communicable disease over the past 2 decades. That is why the government of India also is putting a lot of stress on management of this early identification, recognition of non-communicable diseases, early intervention, so that the target organ damage as well as the disability and mortality is reduced. Next slide, please. 70% of stroke and 89% of both stroke-related deaths and disability-adjusted life years occur in the low and middle-income country. I mentioned this before. And proportionally, more hemorrhagic strokes and on average die of stroke at a younger age. Because mortality is concerned, mortality of hemorrhagic stroke is to the tune of 50 to 70% sometimes at 1 month, whereas in ischemic stroke, mortality is to the tune of 20 to 30%. Next slide, please. So this is a cartoon which shows the incidence of all types of stroke. We can see the one which is marked in red has got high incidence of stroke across the country, and the South Asian countries have got a very huge number of stroke, especially the Middle East countries, Arabian countries also have got very huge number of stroke. Whereas the one which is marked in blue has got a lesser incidence of stroke. Next slide, please. So coming to this ischemic stroke, again, the same country, same region, the same scenario, because ischemic stroke is also more common in the Asian population, South Asian population, as well as the Middle East population. That is what is, and it is less as we move to certain European countries as well as in Latin American countries. Next slide, please. Can I have the next slide? Coming to the incidence of ischemic stroke, is again, as mentioned about, there are about, just previous slide, please, previous slide. Can you just show previous slide?
Yes, this is the previous slide.
Yeah. Okay, this is again a map cartoon which shows the distribution of the stroke incidents, and this slide clearly shows that what is the total number of the strokes as well as the incidence pattern of ischemic stroke, especially thrombotic stroke. And there are over 7.6 million new ischemic strokes every year globally. Of over 62% of all the incident strokes are ischemic strokes. So globally, about total of the total strokes, 65 to 70% comes in the ischemic stroke. And each year, over 11% of all ischemic strokes occur in people between the age of 15 to 45, 49, or 15 to 50 years of age group. That's one of the alarming situations. 10% of the strokes occurs in less than 50 years of age, and even above the age of 15 years, people are having stroke. And every year, over 58% of all ischemic strokes occur in people under the age of 70 years of age. And every year, 45% of all ischemic strokes occur in men. And each year, 55% of all ischemic stroke occur in women. So the incidence of stroke is little higher in women. Many a time, women neglect stroke because the certain rural population, especially in India, they are not given due account to the diseases in women due to gender bias and all. So as far as ischemic stroke is concerned, after the menopausal age, after the age of 45, incidence is more in women than in men. Next slide, please. This is what of intracerebral hemorrhage. Again, the same countries, the pattern of distribution remains the same. The intracerebral hemorrhage is more in various age groups. Its pattern has been described in the Asian countries compared to the other countries. Next slide, please. So one stroke death every 4 minutes in India. That is the statistics which is to be remembered. So every 4 minutes, so once in 5 minutes, one person died due to stroke. 1.8 million strokes per year, and every 40 seconds, one Indian suffers a stroke. So that means almost 4,500 strokes per day. You can imagine every month, every year, how many number of people in India suffer from stroke. So this simple statistics, 1.8 million strokes per year, and one stroke death every 4 minutes in India, and every 40 seconds, one Indian suffers a stroke. Next slide. And prevalence is, again, the systematic studies have come up from India, especially coordinated by strokologists from Dr. Jairaj Pandey and Dr. P.N. Shailaja, past presidents of Stroke Association. And prevalence is about 26 to 757 per 100,000 population. And case fatality is about 22 to 42. Next slide. So this is overall in India, the incidence is about 115 to 135 per 100,000 population, cutting across rural. In Indian, there are only few studies are there. One is a Vellore study, the second one is Ludhiana study, third is Mumbai study, Kolkata registry, and the last one, which is published from Trivandrum Stroke Registry. Almost all of them shows that about 110 to 135 per 1 lakh population is the incidence of stroke in India. And that is more in the urban as well rural. There is not much, there's slightly more in the urban population, but the exact study in the rural data has not been taken. ICMR has initiated an Indian stroke registry across all hospitals in India, both in the private sector as well as the public sector. And after down the line, 5 years, we'll have a full-fledged data. That is what I hope. So what I would like to emphasize here is that stroke is an important disease, non-communicable disease, which has to be identified early and treated so that we can reduce the morbidity and mortality. Every minute, 1.9 million neurons die. And the impact is, if mild stroke, if a stroke is mild, the American statistics shows that if a stroke is mild, the impact is up to $3,500 per year, to a severe stroke to the tune of $15,000 per year for an individual level. So you can imagine how much will be the economic burden on the country as well. So I'm sure that this seminar will throw some light into how we can, all of us can come together to manage the threat of stroke, and we can combat stroke, and how we can make people aware about the early signs and symptoms of stroke and empower them. Number 2 is how the healthcare workers can be empowered to have more knowledge about the management of stroke. And 3, how the policy makers, that's the advocacy role, how we can empower them or how we can advise them so that the proper policy is fixed or policy has been formulated for the country, so that the country, huge country like India, where 140 crore population, the huge number of stroke patients, almost 4,500 per day, will translate into year will be huge and huge. So how we can tackle this a global Indian burden, not only global burden, it's a burden of the stroke in the country, because India is a developing country and the economic impact is huge. So we have to have this hope, this discussion will be will throw pathway and light on this. And I'm sure and appreciate the organizers, the KAHU, for giving this platform, and ma'am, Gracie ma'am also for initiating this seminar. Thank you. Jai Hind.